When sugar levels go awry, meds are often prescribed. The anti-diabetic drug which is widely prescribed is metformin. This is the active ingredient in the pill, but will not be the name that you see on the pill box. To help you figure out if the pill you're taking has metformin inside, I've listed some of the common trade names of metformin. Now, the way metformin works its magic is by decreasing glucose production. The overall result, it helps keep sugar levels in check, protecting the diabetic from the dire consequences of elevated sugar levels. Unfortunately, it also does a few things that are not quite as helpful. This is the problem with drugs. There are always risks along with the benefits. In the case of metformin, one of the risks is it chews up vitamin B12. Numerous studies have demonstrated that diabetic patients taking metformin on a regular basis end up with lower levels of vitamin B12. Low, not necessarily none. The question is it low enough to be worrisome? The short answer, definitely. You see, vitamin B12, which is sometimes also referred to as cobalamin. The reason for this is because right in the middle is an atom of cobalt. It's a cofactor for two enzymes. One of the enzymes it helps is involved in methylation pathways and the other in energy metabolism. So when it's missing in action, a whole range of problems can arise, among them permanent nerve damage, megaloblastic anemia, and vascular complications. Nerve damage and vascular complications, these are the two big problems facing someone with diabetes. They do have fancy names, neuropathy and retinopathy and macroangiopathy. But when all is said and done, the complications of diabetes revolve around nerve damage and blood vessel damage. High sugar levels are typically to blame for this damage. This is why it's priority number one in diabetes to keep those sugar levels within a normal range, something metformin is good at doing. But at a price? Remember, diabetes is not something you're cured of. It's more about management. Sadly, even when sugar levels are managed well, complications can arise. Specifically, nerve damage and vascular complications. Robbing Peter to pay Paul doesn't really make sense. Join us for this episode of Better Body Chemistry TV as we see how to safely use metformin to manage your type 2 diabetes. Better Body Chemistry TV is brought to you by Dr. Sandy, a scientist turned gremlin buster, helping you battle sugar gremlins, heifer lumps, and other health horribles through better body chemistry. Remember, small things can make a big difference to your health. So, metformin chews vitamin B12. How it does it is still not clear, but it does. So, if you've been taking metformin for 6 months or more, you need to make a plan to get a little extra vitamin B12. You need approximately 2.5 micrograms per day. Your body cannot make it. Plants can't either. Some bacteria can make it. Many just steal it from you or their neighbors. To get enough, you need to consume animal products. 100 grams of liver will give you 26 to 58 micrograms of the stuff. 100 grams of steak or a pork chop would give you around 1 to 3 micrograms, and an egg yolk will give you 1 to 2.5 micrograms. If you're a strict vegetarian, you're going to be shortchanged. Unfortunately, even if you're eating enough, it does not always mean you're getting enough. Getting it in is a process. The body uses a rather sophisticated process to get vitamin B12 from the gut and into the cells that need it. 15 different proteins are involved. That means there are 15 different points where things can go wrong, and they often do. Vitamin B12 is often a nutrient in short supply. Now, how much vitamin B12 you're getting depends on how well this pathway is working. The efficiency of this pathway depends on your genetics as well as your body chemistry. If you're taking metformin, the pathway is compromised. So while eating more will help, it might not always be enough. The supply is depleted over time. Our bodies do store vitamin B12. On paper, you should have more than enough to meet your needs, but years of metformin use could leave you with low levels, even if you're eating enough. This also means simply swallowing a vitamin pill full of vitamin B12 might not fix the problem either. You need to bypass the sophisticated absorption system, which is being sabotaged by metformin. There are two ways to do this. You can use a sublingual formulation. This is a formulation you put under your tongue. Or you can be brave and get a shot. If you're managing your diabetes with metformin, make sure you're keeping your vitamin B12 levels topped up. This will help you create better body chemistry and better health. Interested in discovering more ways to create better body chemistry or need a little help getting your body chemistry on track, visit our website at www.betterbodychemistry.com. Browse our library. We have tons of resources for type 2 diabetics. The advice is simple to follow and based on real science, not hype. Know someone who takes metformin to help them control their sugar levels? Share this video with them so they know how to maximize the benefit from the metformin they're taking. And if this is your first time here, be sure to subscribe to our channel so you catch future episodes of Better Body Chemistry TV. Thank you so much for watching, and I'll see you next time. Remember, small things can make a big difference to your health.